Good day, everyone. This is Ken Pike. I'm Director of Social Policy for the New Brunswick Association for Community Living. As you are aware, we're in the middle of a federal election. And our national association, the Canadian Association for Community Living, has been working hard to set some key priorities for our organization and for people with an intellectual or developmental disability in their families. So this presentation is going to review some of these election priorities, and we'll go through some of the key areas that we think that the Government of Canada needs to focus on over the next 4 years. So the Association is calling for a National Disability Action Plan, and this is something that will be needed to ensure that we're focusing on issues related to people with a disability who live throughout the country. So just some information on statistics, recent survey information from 2017. About 20% of Canadians, or roughly 6.2 million people aged 15 years and over, have one or more disabilities. And about 4% of this group have a developmental disability or delay. So this is key that people with the disabilities are a significant voting bloc in Canada. We have a population of just over 37 million, so a good segment of our population does live with a disability. So we're asking political parties throughout Canada to adopt commitments to have a National Disability Action Plan as part of their election platform, to promote health and well-being, advance employment opportunities, as well as opportunities for community inclusion, and fund accessible housing to make Canada a more accessible country. So in 2010, Canada ratified the United Nations Convention on the Rights of Persons with Disabilities. And as a result, all levels of government in Canada are obligated to respect, promote, and protect the rights of people with disabilities and address barriers to full participation, inclusion, and citizenship. So we're asking that the National Disability Action Plan be rooted in our obligations under the Convention and contain pieces that will help us meet our obligations. We're also asking that the National Disability Action Plan be developed and drafted using a far-reaching disability and inclusion policy lens. And this places people with disabilities and their families at the core of decision-making, requiring government officials to consider the impact that all policy decisions, not just disability-specific ones, that will have on people with a disability. And there's some more information about a disability inclusion lens at the link provided on this slide. So we're looking at 4 key priority areas for a National Disability Action Plan. So we're looking at promoting health and well-being, tackling poverty through employment and economic security, making good on the right to inclusive housing, and moving beyond the Accessible Canada Act. So we'll go into more detail with in each of those priorities areas. So first one is promoting health and well-being. So we're looking at addressing barriers to health and well-being and ensuring quality medical care for people with a disability free from discrimination. So 3 main priorities under this area: promoting access to palliative care for all Canadians, including those with an intellectual disability, There are some gaps in the provision of palliative care currently, and we're looking for that care to be further provided to all Canadians. Another key area is addressing gaps in mental health services for children and adults with an intellectual or developmental disability. And we know from our work here in New Brunswick that this is a major gap for the people we support. And so we're looking at some ways that the Government of Canada can support the work that needs to be done to make sure that people have access to good quality mental health services. And lastly, we're looking at preserving equality through the end-of-life criteria for medical assistance in dying. And this is a key area of safeguards for people with a disability to ensure that that medical assistance in dying laws are not used to end the life of individuals unless they are near the end of their life. So returning to the area around gaps in mental health services for children and adults with an intellectual disability, as noted, that many Canadians with disabilities struggle to access appropriate mental health care. And we know this is especially true for people with an intellectual and developmental disability. Research and consistent research has shown that people with an intellectual or developmental disability are 3 to 4 times more likely to experience a mental health issue than the general population. However, we know that appropriate mental health services are often unavailable or completely inaccessible. So addressing gaps in mental health services for children and adults with an intellectual disability, we know that one of the areas of concern has been that people in the mental health field, practitioners, clinicians, lack specialized training required to confidently treat people with an intellectual or developmental disability. And we also know that the connection between disability and suffering has been so normalized that some medical professionals mistakenly believe that the intellectual or developmental disability in itself is the cause of the person's mental health concerns. So in other words, we're looking at people attributing a mental health issue to their primary disability. And so that's a major issue. So we're looking for political parties to adopt and fund a national policy and strategy that addresses this mental health crisis for our population. So some of the things that we would include would be funding for innovative research to identify and respond to barriers to mental wellness for people with a disability, incentivizing provinces to adopt best practices and train service providers in offering specialized care for people with an intellectual disability who have a co-occurring mental health concern, enhancing access to publicly funded psychotherapy through Medicare, and addressing the waiting list that we know that exists currently. Under the area of promoting access to palliative care, including those with an intellectual disability, today we know that medical assistance in dying is offered as a publicly insured service in Canada, meaning that any person can access, provided they meet the eligibility criteria. But there's no similar guarantee for those in need of palliative support. So we know that more than 75% of Canadians who wish to die at home, but only 15% have access to the palliative care they need to do so. And the disability rights community is also concerned that lack of access to good quality palliative care is one of the main reasons people with complex needs request medical assistance in dying. So we want to sort of reduce that gap. So if we are able to offer and provide quality palliative care, fewer people will feel the need to access medical assistance in dying. So we're asking political parties to commit to amending the Canada Health Act to include palliative care as a listed core service. And then turning again to the end-of-life criteria on medical assistance in dying. So this is, as noted earlier, this is what we consider the hard line that prevents death to discrimination or internalized stigma. So we're looking at this is a key safeguard, and preserves equality, ensures that we fight for the lives of people with disabilities, many of whom confront significantly higher rates of poverty, unemployment, violence and abuse, suicidal thoughts than people without disabilities. And it prevents a life featuring disability from being framed as a life worse than death. So, so we're very keen on ensuring that the end-of-life criteria is maintained. There are currently issues that are going through our court system. Recent court decisions out of Quebec has put this end-of-life criteria at some risk. So we're looking at political parties to protect and preserve the end-of-life criteria in Canada's medical assistance in dying regime. So it's really an important issue to talk to your candidates about. The next area is tackling poverty through employment and economic security. So we know that people with disabilities are twice as likely as Canada's general population to live in poverty. So we're looking at a national action plan to address the gaps in employment and economic security through the following measures: adopting a targeted disability employment strategy, amending some of the provisions around the registered disability savings plan, and making the disability tax credit refundable. So in terms of the RDSP, Registered Disability Savings Plan, so we know that these are long-term savings plans that are designed to provide financial stability for people. Currently, there's more than $3 billion in these RDSPs, which are currently unusable for practical purposes such as securing housing stability for people. And there's also significant barriers preventing people with disabilities and their families from contributing to RDSPs, mostly around the criteria for the disability tax credit. And given sort of some of the restrictive rules for RDSP withdrawals, and that mainly relates to the what's called the 10-year rule, that needing to wait 10 years beyond the receiving your grants and bonds before you can withdraw without penalty. So we know that many people will need to reach age 83 before maximizing their benefits. So this might significantly limit their effectiveness, particularly as people with disabilities tend to have shorter lifespans. So we're looking for 2 policy changes that would help people with an intellectual disability and other disabilities and their families to better access and utilize the RDSP. So one is changing the 10-year rule to allow for greater flexibility in making RDSP withdrawals. And as noted earlier, this rule is not really sensitive to the life expectancy of people with an intellectual disability, and people who receive grants and bonds to age 49 then often have to wait 10 years to withdraw money to avoid repayment penalties. So people would be in many circumstances waiting until they're 59 or 60 before they're starting to use this money. And we know that many people could benefit from access to RDSP earlier in their adult life, and potentially before all their grants and bonds are received. The current rules acknowledge that people may be vulnerable when they are facing clearly shortened life expectancy due to a medical condition. But beyond that, people really do have to wait until this 10-year rule, 10-year period is exhausted before they're withdrawing money. Otherwise, they're going to have to repay money back to government. So people might want to access funds earlier for a variety of reasons beyond those related to their health. The other issue with regard to the RDSP is what we call the issue of legal capacity for people with an intellectual disability to open and manage their RDSPs. So typically setting up an RDSP involves legal and contractual obligations with financial institutions. And people with an intellectual disability often rely on their parents to set up and become the holders of the RDSP. And they can do this without too much hassle because of a temporary measure that the federal government introduced in 2012. So essentially this measure allowed parents of adult sons and daughters to set up and manage these RDSPs. The hope was, though, that provinces and territories would then reform and change their laws to develop some more permanent solutions around getting people on as holders of the RDSPs. But so far, the majority of provinces and territories have failed to do this. So we're looking for a national solution to ensuring that there are people around that can manage these RDSPs after parents are no longer in the picture. So we're asking political parties to commit to both revisit the 10-year rule and address the legal issues of legal capacity so people with a disability and their families can appoint replacement plan holders under some type of national solution. And there have been some ideas put forward some time ago around this, and that would put everybody on the same playing field with respect to who can be the holders of an RDSP and be permitted to manage those on behalf of individuals who are beneficiaries. We're also looking at making the disability tax credit refundable. So, so the current disability tax credit provides some tax relief to only 1/3 of working age Canadians with a severe and very severe disabilities. For most of the 750,000 working age people with severe and very severe disabilities, the credit is really of limited assistance because their income and earnings are too low to be taxable. So this can impact families, and the credit can be transferred to a family member who's providing care and support. So families do benefit in some ways. But we're looking at some different ways of thinking about this credit. So, so a lot of people with a disability live in poverty without resources to cover disability-related expenses and their other basic needs. And so keeping this credit as a non-refundable credit contributes to the cycle of poverty. So we're asking political parties to commit to making the disability tax credit refundable. And this would involve providing indexed income through their tax system to help cover disability-related costs. Perhaps paid either monthly or quarterly to people. So, so the refundable credit would actually put money directly in the hands of individuals that qualify for the credit. And so it's help to certainly level the playing field for people with an intellectual disability and their families, and including those who continue to fall behind due to rising costs related to their disability, as well as other costs for basic needs. Making the credit refundable would also require working with provincial and territorial governments to ensure that the credit is not clawed back for people receiving provincial, territorial social assistance benefits. So there would need to be some agreement that if a credit was refundable and provided a regular income for those who would qualify for it, it's not going to be taken off social assistance benefits. So the other area to tackle poverty through employment and economic security is adopting a targeted employment strategy. We know that around 400,000 working age adults in Canada with a physical or intellectual disability are currently unemployed, despite many of these people being ready, willing, and able to work. So we're looking at it for a coordinated employment strategy for people with a disability across Canada. And this would include having the Government of Canada taking the lead on employment within the public service, while creating a comprehensive strategy that engages employers, educational institutions, nonprofit organizations, as well as provincial territorial governments to ensure more Canadians have access to real work for real pay. And we're looking for Government of Canada in connection with its current legislation called the Accessible Canada Act to hire at least 5,000 people with disabilities over the next 5 years. It's important that government show leadership in hiring and providing opportunities to a diverse range of people with disabilities. So seeking out people that have been kept away from the federal public workforce, particularly people with an intellectual disability. So in summary, we're asking that political parties commit to developing and adopting a targeted and coordinated strategy for people with a disability around employment, demonstrate best practices in inclusive hiring when meeting their Accessible Canada Act hiring commitments, and sustaining and increasing funding to the National Ready, Willing, and Able initiative. And this is a current initiative through the CACL and our partners on the autism community to work with employers to offer employment opportunities for people with an intellectual disability and people with autism spectrum disorder. So it's currently in its second phase, just committed funding for another 2.5 years. And we're showing some substantial outcomes for people with an intellectual disability or autism who have found employment through this strategy. So we'd like the federal government to continue with that. Making good on the right to inclusive housing. So we're looking for building upon work around the current national housing strategy, and asking the next federal government to stand behind the right to housing, to fund affordable and inclusive housing, and to make use of inclusive housing indicators. So the right to support and live in community is really inseparable from the right to housing, and both are guaranteed under the UN Convention on the Rights of Persons with Disabilities. And the right to housing, which has been introduced in the Canada National Housing Strategy, needs to be affirmed and implemented in practice. So we're looking for a national action plan on disability to ground the recognition of the right to affordable, accessible, inclusive housing in Canada's ongoing efforts to address the current housing crisis. So we ask that political parties commit to adopting new legislation to protect and give explicit recognition to the right to adequate housing for all. So we know that affordable inclusive housing is top priority for people with an intellectual disability and their families. We're looking for ways that a national disability action plan to address the isolation and segregation of people with a disability in Canadian society. It is concerning that after years of working towards moving people with an intellectual disability out of institutions, there appears to be a reemergence of institutional and congregate options, things such as nursing homes and other types of facilities that people are currently being directed to live. So this has meant that people who are able to find housing support sometimes are only able to access it in larger segregated settings. And these can be newly created housing options or sometimes increasing the number of people living in an existing location. And this trend is certainly in direct opposition to decades of effort to desegregate people with disabilities and foster their full participation in community. So we're looking for parties to commit to funding affordable, accessible, inclusive housing that can be accessed by people with an intellectual disability, and actively oppose and work to prevent social isolation. Most recently, the National Association for Community Living has been working on developing inclusive housing indicators. And so we're looking at that these indicators direct the funding for housing to developments that meet a test of inclusion. So this work is ongoing, working with partners in the disability community, Canada Mortgage Housing Corporation, to build this housing inclusivity framework. Potentially this tool will help measure specific housing developments and their potential for inclusive housing, and we'll be able to recommend actions that they can taken to better include residents with diverse housing needs. So again, we're asking that political parties commit to embracing and adopting the housing inclusivity framework when funding housing-related projects across the country, so that all Canadians can know the benefits of connection and community. And the last priority area is moving beyond the Accessible Canada Act. So as some of you may know, the Government of Canada has recently passed the Accessible Canada Act, and we want the legislation to impact the way in which elections are happening in this country. And we're asking for governments and political parties to ensure that this current election campaign is very accessible and inclusive, and looking at ways to promote inclusion at every opportunity, looking at standards of how to do this through ways that political parties can make their campaigns accessible, how candidates' offices need to be more accessible, and how people with disabilities can be engaged. So we're looking for all parties to make the electoral process accessible by adhering to the highest standards of accessibility standards and expectations during this current campaign. And going forward, we're looking at now that the legislation is in force, is how we improve our electoral system overall to make it more accessible, that the Canadian Accessible Standards Development Organization board has only recently been formed, so the responsibility for creating an accessible election this year will fall on political parties. But looking at moving beyond these stopgap measures by applying good accessibility standards to the work of Elections Canada into the future, and these must be legally mandated in all aspects of our next federal election. And that's it for this presentation. If you have any questions about the priorities set out by our national organization, please feel free to contact NBACL. And we encourage all listeners to get out and meet their candidates to talk about these priority issues. It's important to know that the Government of Canada has a broader mandate and different responsibilities than the Government of New Brunswick. So a lot of the issues that we currently deal with will fall under provincial jurisdiction, and we continue to work with our provincial government to address those issues. But in this time for our federal election, there are some national issues that deserve our attention, and we hope that you're able to talk to your candidates about those. There are some election materials that you can access in both French and English to present to candidates. So if you need copies of those materials, we can make sure you get those sent to you. So thank you very much for listening to this presentation, and thank you for participating in our efforts to ensure that people with an intellectual or developmental disability have a good and full life in our communities.